Hello, in this video we will discuss about the lactic acidosis. And what is this? This is a basically disease, not severe. Sometimes can be severe, but it can be clear after again normal condition of the person. So the lactic acid is endogenous substrate for gluconeogenesis. So that is remembering thing. The gluconeogenesis is through a lactic acid, and that is constantly produced by muscle and other tissue, and increase with exercise can cause metabolic acidosis, otherwise it is impossible. So the hard exercise during the beginning phase of the person without getting the stamina, so the mitochondria is not, number of mitochondria are not present more, so that is why the uptake of oxygen is impossible. So the lactate is conjugated base, lactic acid. This is why the low respiration does not cause acidosis. And the lactic acidosis is basically defined as an arterial lactate level, basically is level more than 2 millimole per liter plus pH should be 7.35 normal. So the lactic acid is important for the pH of the blood. So increase oxygen delivery in muscle cells, type A lactic acidosis. In this way, the impaired oxygen delivery in muscle cells because the higher exercise. On the other hand, the impaired oxygen utilization in cell, so that is why lactic acidosis type 2, because the utilization will not, due to the some reason, and rarely produce the lactate D in gut bacteria due to the overproduction of the bacteria in the microbiota in our gut. So here simply exercise and the infection of lungs, tissue infection, and on the other hand the heart failure, which that will lead to cause the lactic acidosis. While on the other hand, let's begin to understand the mechanism of the cellular respiration. So the cellular respiration is basically, here you can see this is the cell of the tissue. Basically the oxygen will move into the cell, and carbon dioxide after the aerobic respiration, the electron transport chain, mitochondria Krebs cycle, which that will be consumed to breakdown of carbohydrate, oxidation of the carbohydrate, sugar, which that will lead to produce energy, while the carbon dioxide will respire out. So here is the delivery of oxygen and the consumption of oxygen. Vertical is the consumption and the delivery of oxygen in the graph is horizontally. So in this way, so the delivery when decrease, so the decrease less than consumption will lead to type A, while the otherwise the consumption will be less than the delivery of the oxygen is aerobic state, so the type B. So in sepsis is the septic shock. Lactate elevation may be due to increase the beta 2 adrenergic tone rather than endogenous organ, and hypoperfusion will be occur. The hypoperfusion due to the burning or the elevated lactate, typically the burning of the skin or other tissues. So that is why. And elevated the lactate typically have hyperdynamic circulation, and the oxygen delivery importantly in severe sepsis, increasing oxygen delivery, so may not increase the oxygen consumption. Does it affect the lactate clearance? Not does it affect the lactate clearance. So in this way, when the delivery of the oxygen will be more, so the consumption will be decreased. So in this way, the oxygen will be increased, is known as the hyperoxemia. That is the another problem. So let's begin to understand the type A, and delivery of the oxygen when decreased due to the exercise or other things. So the decrease oxygen delivery and increase oxygen demands in the tissue. So for example, muscle contraction or something. So the hypotension, hypovolemia, trauma and burns, cardiogenic and septic shock, severe anemia and the cardiac arrest, severe hypoxemia, regional ischemia, and compartment syndrome compartment syndrome we will discuss in the next video. So this also the cause of the decreased oxygen delivery. While on the other hand, the increased oxygen demands due to the higher exercise, due to the stress, pain, exercise and fever, and hypothermia, and shivering, seizures, and beta agonists. And on the other hand, the increase of the work of breathing and the tissue infection. So the increase of the breathing, which that will lead to decrease the demand, because the oxygen basically and not fast breathing will not completely breathe in and breathe out. So on the other hand, the mesenteric ischemia, microcirculatory dysfunction and tissue infection, which that will increase the oxygen demands, but the increase of the oxygen demands, but it is not occur. So that is why. On the other hand, the impaired the oxygen utilization. So the consumption of oxygen is the type B, and in this way the drug toxin involved, the propofol, PRIS, and the valproic acid, ethanol, methanol toxins, sodium nitroprusside, HIV antiretrovirals drug, and acetaminophen. On the other hand, the impaired clearance will not occur due to the systemic liver failure, renal failure, and mitochondrial dysfunction, and inborn errors of metabolism and infection, malignancy. So the malignancy basically is lead to impaired clearance, because requirement of the more oxygen. In this way, the more lactic acid produced due to the deficiency of the oxygen, and the vitamin B12 deficiency. And the type D is the bacterial overgrowth in the digestive system, in the large intestine and small intestine, and sugar absorption less in small intestine, bowel syndrome, and the bacteria which that use the sugar to produce more D-lactate due to the overgrowth of a bacteria also. So here I am drawing the bigger picture of the muscle or other tissue, for example. So when glucose will enter into the tissue cell, the myocyte or other, so the glucose will glycolysis to produce pyruvate, and the GAD, the DH, dehydrogenase enzyme, will produce, and pyruvate will be used when the oxygen will be less. So the mitochondria will not uptake the pyruvate because the oxygen requirement for the oxidative phosphorylation. So in this way, the pyruvate will be converted into the lactate. So the lactate dehydrogenase enzyme will again convert into the pyruvate when the oxygen sufficiency. So the occurs when oxygen is absent. So this will be occur. While on the other hand, when oxygen will be occur more, so that is why it will be reversible. So this is all reaction is reversible until the oxygen requirement will be sufficient. While here is the liver, which that's glucose will convert again pyruvate, and this mitochondria, so oxygen less, which that will not produce, and in this way the again that's mechanism to produce lactate, and the lactate is Cori cycle. Basically Cori cycle means the L-lactate will be produced after the dehydrogenation. So the lactate dehydrogenase enzyme will produce the hydrogen ion as well as the lactate, so the L-lactate. So what should you get this concept from this Cori cycle? The Cori cycle we will discuss. So the Cori cycle is the oxygen deprived cell produce lactate. In the presence of oxygen, liver, kidney convert lactate back to pyruvate, and the basically is the repaying the oxygen debt. So in this way you can understand the again conversion of the lactic acid into the pyruvate and again use. So that is known as a Cori cycle. We will discuss in the next video. So here is the lactate clearance can be the 70% from liver, 20% from kidney, and 10% from muscle. So the liver and renal dysfunction will increase the lactate due to impaired the clearance. So when the kidney failure or the liver failure, basically the major liver failure will lead to cause the lactic acidosis more. So in this way, the delivery of oxygen dependent on the following: the cardiac output. So when the cardiac output we can combine with the delivery of oxygen is equal to heart rate into the stroke volume, while the blood oxygen content should be the 1.34 into the hemoglobin into the saturation of oxygen, as well as the partial pressure of oxygen into the 0.003. We can calculate the blood oxygen content. So in this way, the lactic acidosis is basically the normally not cause the lactic acidosis, and it can be clear if the liver failure or kidney failure and muscle dysfunction will lead to cause lactic acidosis, or higher exercise or other things. So thanks for watching. Please make sure to subscribe. Bye.